How does oxygen therapy impact my lungs? Have you ever wondered how oxygen therapy affects your lungs, especially if you have sleep apnea? Let's break it down in a way that makes sense. Oxygen therapy provides extra oxygen to your body, which can be really helpful if your oxygen levels drop during sleep. This is often the case with sleep apnea, where breathing stops and starts, causing low oxygen levels. When you use oxygen therapy, it can help increase the amount of oxygen in your blood. This is important because it can counteract the low oxygen levels caused by sleep apnea. By improving blood oxygen saturation, oxygen therapy can reduce the episodes of low blood oxygen that happen during sleep. This may help protect your organs and tissues from the harmful effects of not getting enough oxygen. However, oxygen therapy does not fix the main issue with sleep apnea, which is the blockage of the airway. In fact, it can sometimes make things a bit more complicated. When you use oxygen therapy, it might actually prolong the time you stop breathing. This happens because it can suppress the natural reflex that tells your body to breathe when oxygen levels drop. If breathing stops for longer, it can lead to a buildup of carbon dioxide in your blood, which can be harmful. Unlike continuous positive airway pressure therapy, which keeps your airway open and reduces how often you stop breathing, oxygen therapy alone does not significantly lower the number of apnea episodes. It also does not help with daytime sleepiness or lower blood pressure related to sleep apnea. Because of this, oxygen therapy is not usually the first choice for treating obstructive sleep apnea unless other treatments are not suitable. For people who have both sleep apnea and chronic obstructive pulmonary disease, oxygen therapy can be beneficial. It can help improve survival by addressing low oxygen levels. However, it needs to be monitored closely. If not done correctly, it can worsen the retention of carbon dioxide in these patients. In summary, while oxygen therapy can improve oxygen levels in the lungs during sleep apnea, it may also lead to longer apnea episodes and increased carbon dioxide retention. It works best when combined with treatments that keep the airway open, like continuous positive airway pressure therapy. Always consult with a healthcare provider to find the best approach for your specific situation.